Welcome to episode 82 of Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're rounding out our exploration of pregnancy with the final stages: parturition, the process of childbirth, and lactation, which supports the newborn after birth. These processes are tightly regulated by hormonal signals and positive feedback mechanisms. So let's walk through how labor begins, progresses, and transitions into postpartum support for the baby. So parturition is the physiological process of labor and delivery, and this typically occurs around 38 to 40 weeks of gestation. It involves three stages: dilation, expulsion, and placental. So the dilation stage begins with the onset of regular uterine contractions. During this time, the cervix will dilate to about 10 centimeters, and this process can last several hours, especially for first-time pregnancies. The expulsion stage occurs when the cervix is fully dilated. Stronger, coordinated uterine contractions push the fetus through the birth canal. Ultimately, this ends with the delivery of the baby. However, once that's occurred, it's not done yet. Okay, and so we have the placental stage. This occurs after delivery of the baby, and in this stage, the placenta, or afterbirth, also needs to be delivered. Now, labor is driven by a positive feedback loop. The stretch of the cervix stimulates the release of oxytocin from the posterior pituitary. Oxytocin causes uterine contractions, which further stretch the cervix, which leads to more oxytocin release. Okay, and this process keeps going on and on. Now, the placenta also produces and releases prostaglandins, which help amplify these contractions. Now, after delivery, estrogen and progesterone levels drop, which is important for initiating milk production. The uterus gradually returns to its pre-pregnancy size through something called involution. So let's talk about lactation for a minute. Lactation refers to the production and release of milk from the mammary glands. So the hormonal control of lactation is due to two hormones. So there's prolactin and oxytocin. Prolactin is secreted by the anterior pituitary and stimulates milk production from the mammary glands. Levels rise during pregnancy, but milk production is suppressed by high levels of progesterone and estrogen. After birth, the drop in both progesterone and estrogen allows prolactin to promote lactation. Then there's oxytocin. Oxytocin is released from the posterior pituitary. This stimulates milk ejection, also known as a letdown reflex, and this occurs in response to the infant suckling. So the suckling sends a signal to the hypothalamus to promote continued prolactin secretion for milk production, as well as oxytocin release for milk ejection. This is yet another example of a positive feedback loop. So key takeaways. Parturition occurs in three stages: dilation, expulsion, and placental. Labor is driven by a positive feedback loop, which involves oxytocin and prostaglandins. Lactation is initiated after birth as estrogen and progesterone levels fall, and prolactin drives milk production, oxytocin enables milk ejection. Both labor and lactation rely on positive feedback mechanisms. So that's a wrap on episode 82 of the Pulse of Physiology. I'm not sure what the next episode will be, but until next time, keep questioning, keep exploring, and stay curious.